Cases of COVID-19 certainly decreasing across Texas, but the effort to get more people vaccinated is certainly not. In today's KSAT Q&A, it is Thursday, so we welcome Dr. Ruth Berggren, infectious disease specialist with UT Health San Antonio. Doctor, thanks as always for being here, and we know that you've been a big part of community outreach, leaving the campus of UT Health, going to mobile vaccination sites, speaking to churches, various organizations, trying to get more people to get the shot. And I'm curious if going to these places, you're finding that minds are changed just by having somebody there to answer their questions or taking vaccines to people's own neighborhoods.
Right. Well, I have to believe that it's doing some good. I don't have real statistics for you to answer that question. I have personal anecdotes, though, of people who have been holdouts for weeks, and I find that they respond best to an attitude of unconditional regard, respect, and gentle re-education as opposed to forceful pressure tactics. And I've had people that are patients of mine and people that are friends of mine that have eventually come around. Certainly the folks that I speak to, whether on Zoom or in person in town hall style meetings, really express a lot of gratitude for being able to ask questions from a doctor who knows about these things. And so there's a good dialogue there, and I regard it really as an ongoing process.
Talk about an ongoing process. You've been on the cutting edge, and UT Health certainly on the cutting edge of these targeted responses that the mayor was talking about today, about how that's kind of where the vaccination process is going. Not so much like the mega sites at the Alamo Dome and the Wonderland of Americas, but a more targeted response. I want to specifically talk about the fact that why you think this would work. Is it the next step, and Fiesta having part of this targeted response as well?
Right. Well, why I think it would work is purely based on hope, because we've seen the numbers dwindle that were coming to the large hubs before, the Wonderland Mall, et cetera, and our own Hurd Auditorium at the nursing school. The numbers just dwindled and dwindled. And we do find that when we work with, say, a parish priest or a community organizer and arrange ahead of time with them to notify local people that we're coming, that we get a turnout. It may not be thousands of people vaccinated, but cumulatively over time, we're vaccinating 50 here, 100 there, and these are adding up. When I've been to these venues, I oftentimes see working parents who are coming with their kids in tow, very grateful that they can come and get vaccinated at 7:30 p.m. at a venue that's very close by where they live. And so this is what we're working on, because it's what we have to work with. And honestly, it's been very gratifying. Even though the numbers are small, it's nice to go to these smaller community venues and really interact with people and feel like you're part of their community. Now, we do have some larger venues and opportunities coming up, because you mentioned the opportunity to get vaccinated during Fiesta. And I'm pleased to report that UT Health and Metro Health are partnering up, and we have a number of opportunities where we will be delivering the Johnson & Johnson one and done vaccine to people that are attending Fiesta. So you see in this lovely graphic here, you'll have opportunities on June 17th, 19th. 19th, there's actually two different opportunities, June 20th and 27th. There may even be an opportunity at NIOSA, but we're awaiting final confirmation of that one. These are free. You will not be charged. You do not have to pre-register. All you do is walk up, and you can get vaccinated by somebody from Metro Health or UT Health. And for an added bonus, I'm told that particularly for the UT Health June 19th event, we have a special Fiesta medal that says vacunate that has been made, and it'll be, I think, a collector's item one of these days. There are only 1,000 of them that were struck, so you want to get in line and come and get your vacunate medal from UT Health.
Yeah, you're talking Fiesta language right there when you're talking about getting people out to these events. That's
perfect
for sure.
Incentive for that setting. We do have a couple of viewer questions. I want to get to one before we have to wrap up here. Focused on the vaccine. This person asked, my vaccine was Moderna. If I need to get a booster next year, do I have to get the same Moderna shot, or can I get another one of the vaccines available?
So that Stay tuned for more information. More information still to come. There are actually some mix and match studies going on right now in a number of places where large numbers of people are being studied and they're getting Pfizer number 1, Moderna number 2, or vice versa. And we should have answers to that type of question with data soon. So I can't give you a firm answer yet. I think there's a good chance that you will be able to have a different kind of booster, but wait till we get the data.
Dr. Ruth Berggren with the Long School of Medicine from UT Health San Antonio. Always appreciate your insight and your time.
Happy to be with you.
We'll see you next time. We'll be right back.